Добрый день, уважаемые коллеги. Я рада
I'm
приветствовать
happy
вас.
to welcome you in our studio at GuideR Forum, and today's session is called Sustainability of Healthcare Systems Facing the External Challenges. So, colleagues, this is a very interesting event. It is, the agenda is very busy, as it is usually the case in GuideR Forum, but today this format is unusual. We have two people here in the studio, but I'm sure that there are a lot of viewers, those who cannot stay with us here in this venue, within the framework of GuideR Forum. So I would like to introduce myself and my colleague. Today I will be moderating this session. My name is Aksenova Elena, Director for Scientific and Research Institute for Organization of Healthcare and Medical Management. And my colleague today, one of the main speakers, is Panarina Irina, Director General of AstraZeneca for Russia and Eurasia. And also, we will have two speakers in this session from United Kingdom and France, and they are online. I can see them on the screen now, and they will be working today with us in a remote format. So, dear colleagues, today we are going to speak about healthcare system. We all know that 2020 was a challenge for all of us, and we learned a lot of lessons from the pandemic, the new coronavirus infection, and today we can say that the system of healthcare, not only in Russia but across the world, has changed a lot. A lot of medical organizations were reformatted, and the schemes of routing of patients were changed, the treatment of patients and preparation of medical specialists. So it all impacts the sustainability and workability of the system of healthcare. We understand that the system of healthcare of 2021 is different from that of 2019, and we will never get back to that previous era. And now, having accumulated such large experience in quick changes introduced into the system of healthcare, we know where to go today. And today we're going to speak about the criteria, the KPIs that can help us assess the efficiency of the healthcare system of 2021. So, colleagues, I would like to say a couple of words about the research we carried out together with our international experts. Part of the team is here with us today in this venue, and some of them are with us in remote format. A couple of words about the research. It was initiated by the London Economics School mid-2020, and it was devoted to questions related to the sustainability facing the challenges and the reliability of system of healthcare. So one of the initiators will be the keynote speaker for this session, but in our research, 7 countries participated. One of them is Russia. And within the framework of this session, we would like to discuss the following points. What can become the system of coordinates for assessment of healthcare system of today and tomorrow? What we understand by saying sustainable healthcare system? We need to articulate general terms that can help us to assess the system of healthcare in the future, understand what contribution it makes into health of people of our country and other countries in the world, and what the main characteristics are for sustainable healthcare systems in the world that we can articulate today and work alongside with them today. Now I'm giving the floor to our main keynote speaker, Alistair McGuire. He is representing the London Economics School, and within the framework of his presentation, he will offer us the term of sustainability that was articulated within the framework of our research. But this is not the whole team. Of course, London Economics School initiated the research and the World Bank supported the project, and AstraZeneca, this prominent company with their huge experience in managing large projects across the world, they acted as far as I understand, as the financing party for the project, and also added some content into the development of a new system of coordinates for assessment of sustainability of healthcare systems. So the floor goes to Alistair. Alistair, you're online. Please, the floor is yours. I hope Alistair can hear me and is ready to show the main results of the international research we have conducted, and we'll talk about how we will use these results in the future. And I will also ask the main questions that might be of interest for our listeners today. So, sustainability of healthcare systems, is it different from one country to another? Alistair can answer this question definitely, having the information across our 7 countries. And can we create a general system of coordinates to measure the global sustainability of healthcare systems? Alistair, the floor is yours. Please, you're welcome.
Okay, thank you very much, and thank you to the GAIDAR Forum for the invitation to speak about our partnership, and to you, Elena Aksenova, for moderating this session. I'll talk a little bit about the partnership, as you'll hear in a moment. It's a partnership which was initiated by the LSE, the World Economic Forum, and AstraZeneca, but we're hoping to grow the partnership as we go forward. And although the partnership came about as a direct result of the COVID-19 pandemic, as you'll hear in a moment, we're using the pandemic as a catalyst to take a wider look at healthcare systems and to try to look at how healthcare systems can react and change policies globally to become more sustainable and resilient as systems providing care for the healthcare for the populations. So if I turn to your first question, Elena, does the concept of healthcare sustainability differ across different countries? Well, obviously, the answer is going to be yes, that all healthcare systems are, of course, different. But interestingly, they face fairly common problems. Many have aging populations, all have populations with increasing comorbidities and chronic healthcare as they age. There are workforce issues which are common across all countries' healthcare systems, funding issues, and even the use and diffusion uptake of new technologies are a common problem to all individual countries. But as the COVID pandemic has shown, healthcare systems can learn from each other. I mean, one of the great things which has come out of this pandemic, maybe the best lasting benefit, is that healthcare systems have cooperated widely to try to face the specific problems of the pandemic, and we'd hope that that cooperation will follow on into a consideration of healthcare systems as we move out of the pandemic. So whilst the problems are common, of course, the solutions may be specific to individual countries and may not be directly transferable, but I think the direction of travel in terms of providing solutions to healthcare systems to maintain sustainability and resilience can be at least indicated, and the general direction of travel can be indicated. So while sustainability will mean different things to different countries and to different continents, if we can build on robust evidence gathered at the healthcare system level, we can aid all countries to help improve their healthcare systems and better deliver healthcare for the populations. And that's indeed the aim of the partnership. The partnership itself, it was set up, as I said, that across the LSE and the World Economic Forum and AstraZeneca. It started in September 2020, just last year. And the idea was to consider both how to identify healthcare sustainability and resilience, and also to put in place some policy measures built upon evidence, research evidence, which would help sustain sustainability and resilience at the healthcare level. In fact, one of our first findings was that even the definitions of the concepts sustainability and resilience of healthcare were open to many different interpretations, and the use of the terms differed across different environments. So we've produced, as part of the work, an outline of what we think is a robust definition of sustainability, which relates to the long-term objectives of healthcare systems, and resilience, which are the short-term responses to shocks to healthcare systems, which we're going to build upon, and hopefully build upon this knowledge to provide ongoing research-based evidence to identify the policy changes that individual countries can look to help achieve the objectives of their own sustainability and resilience within their own countries. And that's really the idea behind the partnership, to help both maintain evidence on sustainability and resilience within the healthcare sector, but also get that evidence translated into policy so that healthcare systems within individual countries, but globally, learn off each other, but move forward together to create sustainable systems and resilient systems. And of course, we're one partnership. We're not the only people doing this. There is a lot of interest here. I think our partnership builds off the UN sustainability goals, one part of which is to deliver universal healthcare funding and financing for healthcare systems globally. And I think that the environment is correct just now, is right just now, to enable us to build off a number of different approaches and different partnerships, different policy issues going forward. So I think the timing's absolutely perfect. And as I say, we're just growing this partnership at this point. So within the pilot phase, and this really is a pilot phase for the partnership, which started in September 2020. And we hope to finish with some results coming through into the first quarter of 2021. And really, because it's the start and it is the pilot, we've chosen 8 countries across which to consider issues of sustainability and resilience at the healthcare sector level. These 8 countries are the UK, France, Germany, Poland, Russia itself, Vietnam. And we're using those as case studies to try to develop both the definitions of sustainability and resilience, but also within those definitions to try to build up different domains of sustainability and resilience. And that's what's on this slide just now. The pilot themes are based around the case studies, which build off these 5 pilot themes. And then going forward, we hope to have themes developed in terms of trying to define domains as we move forward through this year, as we grow the partnership, but also try to grow the research evidence that we're building off. So, for example, in the pilot phase, we've concentrated on issues of governance and leadership. And we hope that in reviewing evidence, we found that there's been a fairly narrow focus on efficiency. Essentially, up to date, it's been efficiency's been associated with cost savings, and we want to move that towards efficiency as associated with outcomes and outputs. So efficiency is not just about merely cutting inputs. We want to build our outputs and build our output delivery as part of the types of domains that we're focusing on, the governance and leadership issue. Of course, financing is going to be an issue. We're going to come out of this pandemic with huge problems with how to finance public sector debt, and public sector financing is a particular issue within many healthcare systems across the world. And we hope that the financing will move away from prioritizing short-term and politicized funding towards much more longer-term planning with investment in how to determine financial protection for individuals within individual countries. We also think that there should be more focus upon the integration of healthcare, so primary care as it integrates into hospital care, as it integrates into social care. But of course, integration requires with it some coordination. So you can't have integration without coordination, because then you just get blockages in the system. So if you move from primary care into referral to hospital care, you need to coordinate that better. And as you move from hospital care into social care, you don't want bed blocking. You need to integrate that better as well. Another common problem across the globe is the workforce problem. There's very little evidence that we've found which is specific to looking at what the mix of staffing should be within any healthcare system and within any level of the healthcare within that system. What's the optimal mix of the workforce in the health sector to deliver efficiently the best potential outcome to the population? We also think that there should be systematic evaluation, greater systematic evaluation of new technologies in the healthcare sector. New technologies account for anywhere between 10% and 30% of the growth in healthcare expenditure globally. So it's a very dynamic sector. It produces new technologies all the time, as we've seen with the COVID pandemic, but they have to be systematically evaluated within the context of replacing old technologies, obviously. And there should be more benchmarking and more information generally on the uptake and diffusion of new technologies across the globe. Obviously, we're concerned about service delivery as well as the last point on this pilot theme slide says. We want to improve service delivery by investing in particular in diagnostic techniques, I think, because whilst there are obvious problems with investing in treatments, there's growing issues in investing in diagnostic capabilities, and that's going to become increasingly important as we move towards genetic-based treatments, because obviously with genetic-based treatments, some individuals respond quicker than other individuals. So we need diagnostic investment to show us where the best response rates are going to be. And we're documenting all of these findings within a report which draws upon the case studies from the first 8 countries, with the intent to moving the partnership on in the forthcoming years to include more countries and include more people within the partnership. I'll come back to that in a moment. So the left-hand side of this slide tells you where we are in terms of developing the domains within the pilot themes, and the right-hand side of the slide gives you some indication of the domains that we're moving to in the second wave. We then have this timescale associated with the pilot phase in particular. As you can see, the timescale takes us to delivery of our results within this first quarter of the 2021, with the idea that we'll deliver some form of our results within the World Economic Forum Davos dialogues, and my colleague Bernaert will talk more about that. Arnaud will talk more about that later. So we're well on track. We've kick-started the partnership. We've got interim results, I'd say. We've got case studies from 8 countries which show the feasibility of taking this partnership forward. And now we want to basically advertise the partnership. We want to say it is an inclusive partnership. We want to move to more inclusivity. We want to take the domains, and with the domains, your second question, as I remember it, Elena, was can we measure sustainability and resilience? Well, we think we can once we've got the domains pick up on the measurement of both in a quantitative and a qualitative fashion, the important characteristics of each domains, and that will allow us to then compare across countries in terms of achieving objectives of sustainability and resilience globally. So it's a very ambitious project. I think that we've come at it at the right time, as I said, and we want to encourage inclusivity. So please get in touch with us if you have any questions following this little introduction to our partnership. And we'd hope to include more funders, more researchers, and more policymakers to join the partnership so that the partnership itself can become more sustainable and resilient. Thank you very much.
Alistair, thank you very much for very detailed, interesting report. And now you've confirmed my words. You've said that the main topic, that's partnership. Partnership at different levels of cooperation with clinical specialists, researchers, population within the fight against pandemic. We should join forces, shouldn't create additional barriers, not fight the pandemic individually. Alistair, thank you very much. And I would like to say to our audience that if you have questions, you can ask them. Ask questions through the chat. I will transfer them to our speakers who are online right now. Alistair said several words about the structure of this project and its first stage, and I'd also like to highlight the way we organize this research in Russia. Within Russia, we were working within the with our institute, but we also worked with institutes of the Ministry of Healthcare, Ministry of the Academy of Science, and some external experts from medical and pharma companies, because we wanted to make sure that this wide spectrum, which is supposed to be covered by this project, could be really dived into by different experts. Yes, we had 5 domains, so we collected data for all of them. We were assessing the contribution for each indicator, and as a result, we got a set of recommendations which allowed us to assess possible tools to influence the sustainability and efficiency of healthcare. After this, creating such recommendations, we selected country-specific cases which were either confirming or not confirming such recommendations. These cases were sent to our international team. They have done some analytical work, and then at the level of LSE, we've formed a pool of expert opinions which can assess the sustainability of healthcare, its sustainability in times of a crisis. In Russia, we plan to continue this research together with international experts. For us, we already set the horizon for this research in Russia, in Moscow, and we are going to look into similar issues related to assessing efficiency. Before, we thought that the system is efficient if it's comprehensive and if the level of medical services is high. But now we understand that we need to have higher wider number of metrics, and this is what we are going to work on in the future. Another important issue, when we're talking about sustainability, we also think about integration between different levels of research. We understand that we need to have barrier-free transition from the fundamental research level to the level of clinical research and the level of implementation of these new methods in healthcare. And here it's critical to make sure that businesses and experts, medical experts, pharma experts take an active adult position, supporting research at initial stages and collaborating in this process when there is clinical approbation. And I would like to address Irina, because I think that AstraZeneca is the first company. Yes, we know that pharma companies, they are always competing with each other, but AstraZeneca managed to destroy this barrier very quickly. And as far as I know, at the level of the presidential administration, you've signed an agreement between AstraZeneca and the Oxford University. It was the mutually developed vaccine together with our Gamaleya Institute. So you agreed on the mutual clinical trials. And now I give the floor to Irina. Please tell us about the successful international case about related to corroboration for clinical trials. Elena, thank you very much. You were absolutely right saying that as of now, for sustainable healthcare system, we have to fight pandemic. Right now we're fighting pandemic, but tomorrow we will have to continue supporting the sustainability of healthcare system. For example, through maintaining high collective immunity, because it's possible that coronavirus is here to stay for a long time. Elena, you were also right saying that we are used to competitiveness between pharma companies. But during the pandemic, we realized we shouldn't compete with each other. We should compete with the virus, primarily. And it's also clear that patient is our focus. And here we're talking about the vaccine. And vaccination is the only right strategy for us if we want to find the virus. It's been a year since this all started. We understand that not always, unfortunately, patient is our center of attention. Very often when we're talking about vaccines, there are lots of political opinions, there are lots of interests which are not focused on the patient. We should cooperate, we should work together. If it's just one branch, it's very easy to break it. But if it's the whole pile of branches, you won't break them. That's why we decide to have a team together with the Gamaleya Institute, the Russian Fund of Direct Investments, and Air Farm company. And we decided to study the safety of AstraZeneca vaccines and Sputnik vaccine. Such teams, such combinations, they are really the future. Our project has started, our clinical trials have started, and you can find information about it on the website, about international website, clinicaltrials.gov. This program will include several countries. It's going to be a global one. More and more countries are interested in joining it. We will try to answer a question whether a combination of these vaccines can improve the efficiency of vaccination. We think that the effect is going to be positive, but of course we need trials to be sure. This is a new idea of the heterogeneous boosting. That's when a person receives one component, with one vector or delivery method, and then as a booster dose you get another component injected. It's a vaccine with a different delivery method. And if we are able to, and we are actually sure that we will be able to demonstrate the high efficiency of a combination. We're talking about Sputnik V and AstraZeneca combination. In such a case, if there is high efficiency, this will be also a very important change for the healthcare system, because the healthcare systems will get more flexible when we are talking about immunization for population. Since the beginning of the pandemic, when companies started working on vaccines, when started producing them, different countries started very hectically signing contracts because they wanted to buy at least some vaccines. Because if you produce vaccines as much as possible to full capacity, there will not be enough in the world for collective immunity for all the countries. AstraZeneca and Sputnik, they are leaders by the number of contracts signed. For example, there are some countries where they have both vaccines, and if we do not know whether they could be combined, then it's going to be very difficult, because the doctors will have to remember who received which vaccines, because the confusion shouldn't be there, because there could be problems with availability. But if we realize that vaccines could be combined, besides it give additional efficiency, in such a case, we simplify the task for the doctors. We will create benefit for patients, because it will be faster for them to finish all the stages of vaccination, and they will get the immunity faster, and eventually will improve efficiency of vaccination and revaccination throughout the world. The program which is underway now, it's really unique. It's a good example of cooperation between Russian government and AstraZeneca. This is just the first step. We are talking about the immunity research, but the next step could be a large-scale research related to the use of combination of vaccines. So, for example, we are talking about these two specific vaccines. And then we will be able to collect more data. But before we go into larger scale research, we need to answer main questions of efficiency and safety, and that's what we are going right now. We are trying to go faster according to requirements of our time, and we plan to start in February. Thank you very much. Now you have a joint research with Gamaleya, and this is very important. Such collaborations, they improve our resilience in times of crisis, because you could combine two vaccines. Besides, you create high sustainability of the healthcare system. I will be following your project very closely. Irina, thank you very much. Dear colleagues, I'm going to speed up a little bit because our time is running up, but we have another report from Arnaud Bernaert, head of the Shaping the Future of Health and Healthcare platform from World Economic Forum. This is another major partner of our international research, one of the initiators of it. And as it was said by already, this year the results will be presented. And it's important to understand the role of World Economic Forum in developing and popularizing results of this research and creating the set of universal measures which will make healthcare systems more sustainable. Arnaud, when I was preparing for this session, I found information that Klaus Schwab is usually is very, he says that the system of healthcare of the 21st century is critically different from the previous systems. In your view, is it so? Have you changed? Do we really see lots of changes in healthcare systems after the pandemic? And what could be done to transform global healthcare, making it more sustainable and not losing at the same time all the contacts that we've achieved before during the decades of our work? Arnaud, if you can hear us, you have the floor.
Thank you very, very much. I appreciate being part of that. Thank you for the GAIDA Forum, and happy to work with AstraZeneca and the London School of Economics on this important initiative. And to your question, I think absolutely the systems have to change. Everything we learned during the crisis has been about the good, the bad, and the ugly, of things that need to be maintained and things that need to be avoided. And I would like to start with the global level, where there are a number of reviews that are currently investigating how the governance systems for global health should evolve. I'm thinking about the independent panel on the response of WHO, or the review of international health regulations, just to name two of them, as well as the work that was initiated prior to the pandemics under the leadership of the Global Preparedness Monitoring Board. So the first point is governance when it comes to the global level. The second point is universal access and equity. And we've seen the dilemma of having access to PPEs, critical equipment, and now we're facing the challenge of vaccines. So we will need to make sure that when good instruments have been built during the crisis, and I'm thinking about COVAX, for instance, under the leadership of Gavi and CEPI, two institutions that were launched by the forum, by the way, we think that COVAX will need to be maintained in peacetime to provide for universal access to vaccines. And last but not least, there is the topic of the role of employers. I think employers have been facing significant challenges in the reinsuring of their employees when it comes to mental health matters, and how do you reopen your offices, do you do testing, and we see an emerging community of chief health officers that are going to have an extremely important role, but that's for the global level. And now we're talking about health systems at the national level. And what I think we will see emerge from the framework is that the best national health systems are rewarding outcome, and they pay for outcomes. That's what we call value-based healthcare. They are also very focused on prevention. I think a lot of the comorbidities we have seen happening during the crisis have led to increased fatality rates. So obviously, when you have people that are already sick in the first place, they are highly vulnerable to epidemics and pandemics. And that's very true for patients with cardiovascular disorders or diabetes, for instance. And then we've seen also good things that will need to be maintained, such as virtual care. How do we make sure that more can be done outside of the four walls of hospitals? Last but not least, use of technology. I think we can do quite a bit in the enabling of better healthcare workforces with technologies. And when we do all of that, and we in turn also protect the access to care for the patients that are not affected by the epidemics themselves, and we create a pathway for people to still access hospital, to be diagnosed for all the conditions, or be treated for cancers or other type of conditions that necessitate access to hospital, then obviously you have more resilient healthcare systems. But I don't want to jump to conclusions. We will have to see the framework. And when we see the framework and we launch the framework on the 26th, on the 25th of January in the virtual Davos event, I hope we can rally many more participants, like Ali was suggesting before, more companies, more countries. And with that in mind, we would create a global movement. And this is really what my ambition is for the project. Over to you.
Спасибо, Арно.
Thank you very much, Arnaud.
Действительно, мы все в ожидании
Yes, we
Давосского
are
форума,
waiting for the Davos Forum
публично представить основные результаты
to
наших
publicly
международных
show the
исследований,
results of our international research and outline the perimeter of the next joint stage in this process. And closing this session, I think all participants would agree, and the speakers and the listeners, the subject of sustainability of healthcare is for the first time articulated as an interdisciplinary term, and it does not only cover the resources, definition of resources of healthcare system, people, finance, medical equipment, but it also comprises of the attitude towards all these things among researchers, experts, professionals, and professors. So in this situation, we make the population a real partner in this process of assessment of healthcare systems. So the population is not just a consumer of medical services, but they become an expert. They stay with us together when assessing it. And of course, the responsibility of people is articulated for their own health, and this is very important. And the pandemic showed it very clearly. And from the point of view of the technologies, yes, today is high time when we think about the fact that the sustainability of healthcare systems that these systems can go through crisis in the most effective way if we find the pathway in how to bring the ideas of experts, how to bring them down to products and bring it into the clinical practice. Another trend that can be looked at when we are talking about sustainability of healthcare systems. And closing our session, I would like to say thank you very much to all the participants and invite everyone interested, scientific teams and companies in pharmaceutical area to join our research and offer their ideas for measures that can impact the sustainability of local and global systems of healthcare and will allow us to minimize the risks related to the spread of COVID-19 or any other new disease that we can actually face in the future. Thank you very much. Have a good evening and best of luck, and have fruitful Gaidar Forum.